As we've discussed each week, September is Falls Prevention Month, and Falls Prevention Day is actually tomorrow, the same day as the first day of fall, the season. Did you follow all of that? Well, the change of season is a great opportunity to remind people that falling is actually the leading cause of accidental injuries and death in people over the age of 65. Now, the southern chapter of the Arizona Falls Coalition wants to increase awareness of this problem and let you know that most falls are actually preventable. Today, Marcia Woodburn is here to talk about bone health and why it's so important to take care of your bones. Marcia, thanks so much for being here today.
No problem. Thank you for having me.
Nice to see you. So first and foremost, tell us what you do.
I am a nurse practitioner. I work at Banner University Medicine out of Alvernon Physician Offices, and we run a fracture liaison service.
Got it.
Yes.
Tell us a little bit more about the clinic itself.
The clinic itself is designed, it's an evidence-based program and it's nationally utilized. It's designed to capture patients older than 50 with a low energy fracture. And a low energy fracture is basically a fall from standing height or less, such as if you're walking out your door and you trip over the edge of your door, or your cat or your dog runs by and you lose your balance, you fall and break a wrist or a hip.
Got it.
So that's a low energy.
Falls are a concern. I mean, any way you spin it, and you say that it's important to capture those who have had it happen to them. What's the reason for the importance of that?
Right now, patients older than 50 with a low energy fracture, only 2 to 20% of those patients are being captured worldwide and appropriately screened and treated for osteoporosis, which is one of the most common causes of these types of fractures. So our goal with this clinic is to capture these patients and get them on the appropriate treatment so we can prevent a second fracture.
Got it. And so before we get to osteoporosis, which is one of the main causes of this, what are some other risk factors of falls?
Well, fall risk factors, generally age and vision is an issue with patients falling. Also hearing, if you're not as aware of your environment, that can be an issue as you age. Sometimes those are two things that are not necessarily normal as you age, but they can impact you a little bit more as you do age. And then also, if you do have that first fracture, your balances can be altered. So you may be using a cane, you may be using a walker, and that may impact how you get up the stairs, how you are using the shower, and predispose you to falling.
Right, and as we've said before on the show, having fallen is sort of life-changing for people in the sense that they'll fear it, and they'll change their gait or they'll change their walk, and that can lead to even more falls. And so circling back to osteoporosis, talk to us about what that is and what some of the risk factors for that are.
So osteoporosis, some of the common risk factors are family history. Do your parents, do your grandparents have osteoporosis? Also, certain diseases can predispose you to bone density loss, such as rheumatoid arthritis or diabetes or hyperparathyroidism. Certain medications, such as glucocorticoids, prednisone, those sorts of things can predispose you. And even GI diseases can predispose you to bone density loss if you're not absorbing enough calcium or vitamin D, which are the building blocks for strong bones.
I see. And you have brought actually a couple models to demonstrate what osteoporosis actually is on a physical level.
So this example that I'm holding in my left hand is an example of an osteoporotic bone. This on the right is a little bit, it's more healthy, it's stronger, you can see that it's even thicker. So you can imagine if you were to fall on your hip and your bone was osteoporotic like this, you would have a greater chance of breaking that bone.
Osteoporosis in the name itself means that it's less dense. It's how would you define it?
It's
pores.
Basically, it's porous bone. It's porous bone or thinning bone.
Okay. And so if our viewers are watching this, they suffer from osteoporosis or they want to prevent it, what are some tips that you can give them that can stop this from happening?
Definitely. So one of the best tips that I give my patients when they come is to stay physically fit. So one of the other things I recommend is fall prevention and balance training. And the reason I am working with the Piedma Council on Aging and the Southern Arizona Falls Prevention Coalition is because I want to encourage my patients in that first year after they've had their fracture to really work on preventing those additional falls. If you don't fall, you don't fracture. So it's key to be on top of that.
Certainly, and I mean, it's become part of a national conversation as of late, really. I mean, there's technology coming out that's becoming better at detecting these types of things, and so being aware of it, first and foremost, is the thing that will prevent it, and also, like you say, changing your lifestyle habits and being a little bit healthier. How can people get more information about osteoporosis, about falls, etc., so that they can become more educated?
Sure. Well, we are in town in clinic, the Fracture Liaison Service, and I offer information through the National Osteoporosis Foundation, which is a great resource online, also the National Institutes of Health, and then of course our local Pima Council on Aging and the Southern Arizona Falls Coalition. And we've had multiple events over this past September trying to get out and educate the community in Golder Ranch and here at Banner University, as well as some of the other local hospitals. And we have one coming up at Green Valley where people, on Monday, from 9 to 11:30, where people can learn a little bit more about fall prevention.
Well, I think it's so important that you guys are bringing awareness to this. I mean, I just took a spill last week walking my dog, and so I was thinking, you know what, I could have prevented this somehow, I'm sure. So as always, it's important information to have. Marcia, thanks so much for joining me here today.
Thank you.
Of course.
Appreciate it.
Now there's one more free mini expo. It's this Monday from 9 a.m. to noon in Green Valley, as she stated, as part of Stay Vertical Fall Prevention Day. But for more info and to find even more resources, call 520-790-7262 or visit pcoa.org.